Like I said, 1 in 5 of the world's HIV-infected persons live here in South Africa. Today, government will mark World AIDS Day in Xikundu in Limpopo. Deputy President David Mabuza is set to give the keynote address in his dual role as chairperson of the National AIDS Council. Siphamandla Goge is covering that event for us and joins us live now. Sipa, thanks for joining us. What's the significance of having this event out in Xikundu in Limpopo?
Well, absolutely. It comes at a time whereby the country and the world is grappling with COVID-19. But here, this event has been brought to the village of Xikundu. Usually, rural areas and villages still suffer a lot in terms of dealing with HIV and AIDS. Yes, many people are saying this time around because of COVID-19, seems as if the foot has been taken off the pedal. And many people are worried about, not much being done in the past 2 years to deal decisively with the issue of HIV and AIDS. So today we are in Xikundu village here in Limpopo. Right now we are joined by the MEC for Health in Limpopo, that is Dr. Phophi Ramathuba. Doc, thank you very much for your time. Let's talk about the significance of having this World AIDS Day here in Xikundu village. Why does it matter?
It matters most because to us as the people of Limpopo, rural health matters. And our focus is to say rural people must not be left out, especially when it comes to services. Most of us in the urban areas have got access to these informations. That is why we are even able to have access to false information. So people in the rural areas are only dependent on us as government to have this kind of knowledge and this kind of services. So you can see that also the importance of today. It's not only about listening to the Deputy President when he gave the message. You note that he has been here since yesterday. He has engaged with all the traditional leaders from this area, our traditional healers also from this area, including our faith-based organization, our churches. He has had meaningful dialogues with them, and which were very critical for us as Limpopo, because our way towards defeating this pandemic, no matter which one it is, it's through the local leadership, the local structure. So we felt it's important to say majority of the Limpopo people are rural. And when Limpopo is 80% rural, it means the leadership of the people of Limpopo, it's mostly, they say they are called royal leaders, don't call them traditional leaders.
Now, let's talk about the ongoing stigma. I know in many rural villages across South Africa, even though HIV and AIDS has been with us for decades, but there is still stigma in terms of people who are infected with HIV and AIDS. How do we deal with eradicating the stigma?
I think, firstly, as I've also indicated, the importance of the dialogue yesterday with these community leaders who are respected amongst the community. Now, if they themselves could start to be against those who stigmatize others. Imagine if it's a bishop in the church who stand up and say, no single congregant of mine must be seen to be stigmatizing those with HIV. If it's a chief to say, if indeed in my Xikundu village, no subject of mine must be discriminate or discriminate another. So we started there. And then we must move even into us as healthcare workers to say how we treat patients with HIV. It also contributes a lot. We even call people with HIV and AIDS, we call them names. So those are the areas that we must deal with to fight the stigma.
We commemorate this during another pandemic, of course, COVID-19. Now, let's talk about how difficult it is to continue the fight against HIV and AIDS. Some people are saying, well, it seems as if that fight has been neglected. We are focusing on COVID-19 now. What will be your view?
Truly speaking, in the beginning, it has been difficult. When we started fighting COVID-19, it has been difficult because of uncertainty. People were scared. Those who were HIV positive were worried about going to our clinics to collect their medication. That is why you saw us regressing on the second 90 of people who are eligible for ARVs to be given, and the third 90 of people who are on ARVs to get the viral load suppressed. But however, we managed to come up with our own strategies on how to address the backlog and the catch-up. So what has been happening currently, you can see that even with the 90% of those who must be tested, we've been able to surpass the 90. We are now at 94. We're beginning to catch up even on the viral load to be suppressed. How did we do that? By incorporating HIV, AIDS, TB, malaria, diabetes, hypertension into the whole program of COVID-19. So now we have integrated all the services. Like even when you come here, you will be tested for everything.
Okay. We are out of time. I have to ask you this. You are under fire for COVID-19 vaccinations. You are saying those who have not vaccinated, they mustn't come to Limpopo.
No, I'm just asking you, Magarapa, Magarabashu, Magaisayahina, to say to you, before you come home, we love you, we miss you, we want to see you, it's Christmas. Before you come home, vaccinate. Don't come to Limpopo if you are not vaccinated. You can jump, you can scream, you can attack me. The bottom line is when you are unvaccinated, you have become a danger. Your body is a factory hub for all these variants. You are coming to infect our people, our elderly people who have been vaccinated in majority. And the variant that you are bringing, we do not know whether it's going to be resistant in the vaccines that we've given our people. So do us a favor, vaccinate. If you love us, because we love you. If you love us, you will vaccinate.
Thank you very much for time. That is Health MEC in Limpopo, Dr. Popira Matuba, as we take it back to you in studio.